Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide information on injuries and injury treatments and injury prevention in sports and exercise for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, there's this real concern in medicine, especially if you talk to the infectious disease doctors and the internal medicine doctors, about the overuse of antibiotics. We have people that want antibiotics every time they get the cold or a cold or the flu. They want antibiotics because they want to feel better. But the concern with basically too many people taking antibiotics too often is there's a real concern and a valid concern that more and more of the bacteria are going to become resistant to more and more antibiotics, and then these common antibiotics won't work anymore, and so that's a real problem. But occasionally athletes and active people get upper respiratory infections or real illnesses that need antibiotics. But there are some problems with antibiotics that are worth discussing for your doctor if you're about to play sports, or you play sports regularly, or you're about to compete in some sort of event, or you just like to exercise a lot. So I'm going to talk about a few things and concerns that are worth discussing with your doctor about antibiotics. The first, and probably the most publicized, is with a common antibiotic used to treat urinary infections, and they're a class of antibiotics called Fluoroquinolones. Now that's a big name, and you don't necessarily need to know that, but the common trade names for the common fluoroquinolones are Cipro or ciprofloxacin or Levaquin, levofloxacin, and again, they're used to treat urinary tract infections largely. And there is a concern that there's an increased risk of tendon rupture with those antibiotics. So the patella tendon just below the knee, the Achilles tendon behind the ankle, maybe the biceps tendon in the elbow, there's thought to be an increased risk of tendon rupture. So it's definitely worth discussing with your doctor if you're doing a lot of sports or heavy physical activity and exercise. Maybe he could switch to a different antibiotic. Now, there also is a problem with antibiotics sometimes with diarrhea that comes while you're taking it, antibiotic-associated diarrhea. And that's a real problem for athletes, not just from the diarrhea itself and sort of the inconvenience and how you feel, but the dehydration that comes with that. So it's another important thing to discuss with your doctor. Plus, to minimize the chance of that, you want to take an antibiotic that's, you take it long enough that it kills the organism, basically eliminates the infection, but a short enough period of time and as short as possible to minimize your chance of that antibiotic-associated diarrhea. Another thing that can be really important is photosensitivity. Tetracycline, sulfa drugs, and others have an increased risk of what we call photosensitivity. So if you're out in the sun for long periods of time, like a lot of athletes and active people are, you can get really bad sunburns. In theory, have an increased risk of skin cancer. So that's an important thing to know and talk to your doctor about. If you have to take those, in theory, you could wear clothes that cover up your skin, or wear sunscreen, which generally sunscreen when you're outdoors is a good idea anyway, but it's an important thing to discuss with your doctor. Now, to be fair, this is really not specific medical advice, but I discuss all this because we all, at some point, usually end up needing antibiotics for something. So these are important to discuss with your doctor, or when you go to the pharmacy to pick it up, talk to the pharmacist about this and about some of the side effects of these. If you can get better without antibiotics, that's not always a bad idea. Now, have you taken antibiotics, and did they cause a problem when you were competing, maybe running a marathon or competing in a sporting event? I'd love to hear your thoughts, your experiences. So below this video, leave your comments. I'd love to hear your experiences, and I'll try to respond to them as well. If you like information on injuries and injury treatments and injury prevention in sports and exercise, like this video, subscribe to my video channel. I record 1 or 2 of these a week, and I'd love to share those directly with you. Now, if you know somebody that takes antibiotics or needs to take antibiotics but has had issues with them with sports and exercise, please share this video with them so hopefully it can help them. And last, I share a number of resources completely for free only on with my email list. So go to my website, drdavidgeyer.com, and sign up at the top of the screen. I share resources on ways to stay healthy and perform your best. I thank you so much for watching this video. I hope it was helpful, and again, if you have experiences with antibiotics or want to share your thoughts, leave those below this video, and I look forward to seeing you right here next time.